Hello. This presentation has been developed by the Mid and South Essex Infection Prevention and Control Team. It's to support residential nursing care homes and domiciliary care providers to manage the current Covid-19 pandemic. My name's Cathy Ramsey and I'm one of the Infection Prevention and Control nurses for Mid and South Essex CCGs.
And I'm John Swanson, also an Infection Prevention and Control nurse specialist for Mid and South Essex CCGs.
The aim of the presentation is to support you to recognise the signs of service users with Covid-19 symptoms, how Covid-19 is spread and how you can reduce the spread, cleaning the environment and a little bit around waste management. We've used the chain of infection to support the presentation, and we're going to start with the pathogen.
So coronaviruses are a large family of viruses. They cause infections ranging from the common cold to severe acute respiratory syndrome, also known as SARS. Coronaviruses circulate between animals and humans. Sometimes new variants of the coronavirus emerge, such as Covid-19. Covid-19 has the potential to spread widely, as lack of immunity means everyone in the population is susceptible. Symptoms of Covid-19 typically start between 5 and 11 days after being exposed. It's very similar to seasonal flu. The majority of those affected will have fever and a dry cough with a rapid onset. Symptoms last between 5 and 6 days. Severe illness can start from day 7 and will include shortness of breath, lung inflammation and potentially pneumonia.
Looking at the chain of infection, we're now going to move on to the mode of spread.
Exposure to large respiratory droplets can cause infection. Coughing and sneezing onto mucous membranes, like your eyes, nose and mouth, will leave you more susceptible. You need to have close contact for this to occur, typically within 1 metre. Contact with respiratory secretions also poses a risk, so try to reduce this by avoiding touching your mucous membranes and disposing of tissues and cleaning surfaces. It is not transmitted in the air, it is not an airborne pathogen, unless the patient is undergoing a procedure that generates an aerosol, such as airway suctioning.
Infectious residents can contaminate the environment and other people with droplets from coughing and or sneezing, by touching objects or surfaces with contaminated hands. The staff can contaminate the environment or themselves, other staff and the residents by not washing their hands regularly and by not wearing PPE appropriately. Going back to the chain of infection, we're going to look at the person at risk. As John has already alluded to, Covid-19 is a new coronavirus, and currently all members of society are at risk as they have never been exposed to this current strain. We're going to now look at the portal of entry. The portal of entry is just really a way of getting into the body. So it's the way the virus enters the body, and that can be through the mouth, the throat, nose, eyes. So it's really important during these times to avoid touching these areas, especially when you're removing your personal protective equipment. You need to wash your hands more often, or as often as possible, and always after removing PPE. It's absolutely vital that you follow the Public Health England guidance posters. Moving on with the chain of infection, we're now going to look at the source. So the source of this virus is now anybody who has symptoms and or their immediate environment that may have been contaminated. So effective contamination prevention methods are paramount to prevent it spreading and to attempt to break the chain of infection.
Prevention methods include hand washing. The gold standard is with soap and water. You can also decontaminate your hands with an alcohol-based product. Cough hygiene, such as Catch It, Kill It and Bin It. Standard precautions, PPE use and isolation precautions. Hand hygiene is extremely important immediately before touching a resident or service user, before a clean or aseptic procedure, immediately after touching a resident or service user or their surroundings, after removing gloves and all PPE. Please reflect on the WHO 5 moments for hand hygiene. Hand hygiene posters have been re-provided by the Department of Health. This is the best practice guides on how to do an effective hand wash, and here we have the best practice of how to use a hand rub. These are downloadable from the Department of Health website and should be readily available within your care setting.
Residents and service users' hand hygiene is equally as important as the staff's hygiene. You need to encourage the residents and service users to clean their hands again as often as possible, especially after coughing or sneezing, before they eat and after they've used the toilet. So you need to be offering them either hand wipes or an alcohol-based product. And also, if the resident is able to do so, to use the hand hygiene basin to wash their hands with soap and water.
Cough hygiene is extremely important. You should cover your mouth and nose with a tissue or your sleeve if a tissue is unavailable. You could cough into the crook of your elbow. Encourage residents and service users to do the same. Dispose of tissues directly into a bin, ideally double bagged where possible. Hand hygiene, ideally washing them, is really important after. Water and soap or an alcohol-based product. We should always do this after covering a cough or a sneeze. Personal protective equipment available depends on what you are undertaking at the time. Delivering personal care to a resident or service user within 1 metre, you'll be required to wear a surgical mask, disposable gloves, a plastic apron, and if there's a risk of splash, then you should be wearing eye protection also. Cleaning the room or equipment, you should also be wearing a disposable surgical mask, disposable gloves and a plastic apron. Ensure that PPE is only worn when needed. Avoid wearing gloves unnecessarily. Remember, gloves will become easily contaminated, the same as your hands will. It is vital that you follow the Public Health England posters for putting on and removing PPE. Hand washing after removing PPE is always required. PPE for residential and domiciliary care is highlighted here on the left. If you're undertaking an aerosol generating procedure, you should follow what's on the right. Again, this poster is available on the Department of Health website.
Putting on PPE is important. The PPE you are going to require are aprons, face masks, surgical for your shielded or extremely vulnerable residents, and fluid repellent face masks for those with symptoms of Covid-19 or confirmed Covid-19, and gloves. The posters from Public Health England are available to be downloaded and should be displayed within your care setting. Taking off PPE is vitally important, as there is a process for this, as demonstrated in the posters that are downloadable. If you remove your PPE in a safe way, you minimise the risk of self-contamination. Once the PPE has been removed, it's important to wash your hands.
If you have a resident within your care facility, it's important to practice isolation precautions. The infection, as we know, is transmitted by respiratory droplets and contact with those respiratory secretions. Therefore, the resident or service user should remain in their room, including for meals. They should ideally have ensuite facilities or a designated commode, protective clothing for close contact, protective clothing for direct contact with body fluids, and you should clean the frequently touched areas more often. Dedicate resident and service user their own equipment to prevent the spread throughout the facility.
Cleaning is important. It should be carried out with a detergent followed by a chlorine solution of 1,000 parts per million, so that would be 1 chlorine tablet per litre of water, or a combined disinfectant product. All surfaces that could be contaminated with droplets from an infectious person should be cleaned thoroughly and regularly. It's important to remember the virus can survive on surfaces for up to 5 days. We need to include all high touch points such as door handles, grab rails and walking aids when we're cleaning. Waste management is important as well, in that we need to dispose of our PPE immediately after use. PPE should be double bagged, tied securely and kept separate from all other waste. This should be set aside for 72 hours before being disposed of as normal. Most residential and nursing care homes will have a well-established process for waste management, but it's important to check with local authorities for domiciliary care provision. If you have a COVID positive patient, it's likely that you're going to need a clinical waste stream, in which case you would need to check with your local authority or with your current waste suppliers to set this up.
Further resources are available. You can look at the NHS Coronavirus Support website produced by NHS England, and also there's further information available on what to do in residential care settings provided by the Department of Health. We thank you for listening.